OSU Harding Hospital is located at the Wexner Medical Center campus. We are the psychiatric arm of the medical center. Our vision is to really grow our interdisciplinary teams so that we can provide and promote patient and family-centered care across the lifespan.
We know that health is a unitary construct. It can't be parsed into physical health and mental health. And here at The Ohio State University Wexner Medical Center, we get that. We need to be in and integrated with every medical specialty, and particularly with primary care.
The collaboration with family medicine is something that we think is very important. There's been a lot of discussion nationally about the need for behavioral medicine services in our primary care sites as something that our patients need and want, and we're glad to start providing those services.
It's estimated that up to 30% of individuals with a physical illness, whether that be heart disease or cancer, will also have a mental illness as well. So it's really important that we engage the patient and their family in this knowledge and help them recover both from their physical illness and the mental challenges they have.
Number one, because patients are familiar with the office of their primary care physician and feel very comfortable going to that site. Number two is because if they have to go to a separate place that's identified as a psychiatrist's office, sometimes that doesn't feel very comfortable for them, and we want to be close and accessible to our patients.
The Department of Psychiatry and OSU Harding Hospital are committed to collaborating with the Institute of Behavioral Medicine Research to really advance knowledge on the impact of stress on the body and on the day-to-day lives of patients and their families. How does stress impact the immune system? How does the relationship between stress, the brain, and our immune system impact health? Our own program focused on stress, trauma, and resiliency.
The STAR program is a program to help persons cope with the stresses of high-intensity, high-impact positions that they work in, such as here at the medical center.
There really isn't much organized support for the healthcare providers. I think we're off to a good start at Ohio State with the STAR program.
P4 medicine stands for the 4 Ps of predictive, preventive, personalized, and participatory. And we practice this throughout the medical center in so many ways. And I think with mental illness, this is a really important opportunity for P4 medicine. Preventive, because we want to reduce stress and increase wellness in our employees, and stress can lead to burnout, compassion fatigue, and burnout can lead to depression. We want to be preventive in creating a healthy work environment.
The collaboration between the OSU Harding Department of Psychiatry and the Neurosurgery Department Center for Neuromodulation is extensive and been working together across various clinical, research, and educational efforts. Specifically, we're looking at ways whereby we can employ new neuromodulation therapies to help severe mood disorder or anxiety disorder patients who failed medications or other therapies. And for example, we're exploring the use of deep brain stimulators or brain pacemakers for patients with severe obsessive compulsive disorder and depression.
There are a lot of exciting things happening now, exciting developments in neurotherapeutics and in neuromodulation, and it's really a wonderful thing to be at the cutting edge of the future of neuroscience.
We really have a crisis in Columbus, in the country, as far as the availability of psychiatric beds is concerned. What we've done here under the leadership of Dr. Campo, Amanda Lucas, is to create new beds. So we have new inpatient beds that we've added. We have new holding beds for patients who then can leave the emergency department and be in a quiet environment while they're waiting for their bed.
The impression that we want to leave folks with is that we want to make it new in psychiatry. We want to become a preeminent academic department of psychiatry in the next 5 years. And we want to get there by developing a comprehensive system of behavioral health service delivery that's public health oriented, that's rooted in principles of evidence-based medicine, that's delivered by a group of professionals who are schooled and comfortable with improvement science, and that is focused on patients and families. That's patient and family centers. We want to deliver P4 medicine.